Talks That Matter, a podcast by ToothLens. As we all know, April is Oral Cancer Awareness Month, which is a timely reminder that one of the most preventable yet most overlooked health threats is still too often caught only when it's too late. This is Sukanya, founding marketer at ToothLens, and I'm super excited to be hosting this conversation with two incredible voices from across the globe. We have Dr. Rajini and Dr. Zainab with us. Dr. Rajini Satish is an experienced clinician and director dental benefits and network at ToothLens. She's super passionate about driving tech-led awareness and early care in India. Dr. Zainab, on the other hand, she's a dentist and researcher based in the UK, focused on head and neck cancers, and is building low-cost, accessible screening tools. Welcome both of you. This is the first episode of ToothLens podcast. I would like to make this a very informative and very simple podcast for anyone who is not even from the dentistry space and has nothing to do with ToothLens or anything. If you could tell me in a layman's term, what is the biggest myth about oral cancer that you wish more people knew about, like the real truth about that? Like, what is the myth that you would like to burst? I would like to first start from the Indian perspective and then move to the UK perspective. If Dr. Rajini, you can throw some light on the myth.
So I think one of the biggest myths, at least here in India, is like oral cancer affects only those people who smoke or chew tobacco. Agreed that 95% of the cases of oral cancer are because of one of these habits. But even a normal person can get oral cancer. So the biggest myth would be that I don't smoke or chew, so I cannot get oral cancer.
All right. I have more questions, but I would like to hear the myth that Dr. Zainab can break for us.
The myth I would like to break is people think if they get oral cancer, it's a death sentence. It's not, especially if caught in early stages. A lot of oral cancers present with early warning signs, which if treated in timely manner can cause complete regression of the lesion. So that's the myth I would like to break.
So how does this typically begin then? Like if that's the myth, and are there any small habits or symptoms that we ignore? I'm sure, like, have you both in your practice come across cases like that where, from the Indian perspective, Dr. Rajini, if you can tell us, in your practice, if you've been able to identify that, okay, this patient particularly may have this issue going forward. So what I want to understand is...
One of the most difficult things why this oral cancer is so much high in incidence is because these problems are very unnoticeable by a patient, by a person, a layman, right? It can be a small sore. A lot of people get mouth ulcers, but ulcers which are not healing is a cause for concern, which cannot be discerned by a layperson, right? Then secondly, there are so many issues that are painless. The lesions the doctor was mentioning, it starts as a painless lesion. So anything that is not associated with pain does not warrant a trip to the dentist, at least in India, because also there's a dental anxiety part of it which is associated with this. So these things compound the fact that, a lot of people miss these initial symptoms. So I do come across a few cases in my practice where it's as simple as a loose tooth. You wouldn't give a second thought about having a tooth that is shaking or something like that. In fact, this happened with one of my patients. Very unfortunate. The upper middle class type. Very educated, avid traveler, businessman, etc. All the no habits, a teetotaler, so to say. He just had presented with a symptom of a couple of teeth that were shaking, which was there for some time, probably a year or so, which he did not really, it didn't bother him, so he didn't really take into fact that he needs to get it checked out. So what happened was during one of his travel time, one of the tooth just popped out in the mouth on its own. And of course, people don't give it a second thought. It's like, okay, one tooth out and that's fine. So after a couple of weeks, he found some soreness still persistent in that same area where the tooth popped out. And that's when he was referred by one of my patients. And that's when I connected with him. And since he was not in the place where I practice, I initially did a SmartCheck with our AI scan. We do have an AI scan where we do a basic, cursory review of the oral status. So I got him to do this oral scan, and subsequently, when I looked at the scan images, I was a little concerned because any extraction socket it shows signs of healing, where a dentist can easily identify which is normal and what is not normal, what is abnormal. So unfortunately, he showed signs of some abnormalities which warranted an immediate call to action. So I can't really alarm the patient because he was traveling, but I did do a video consult, followed it up with a video consult, where I just kind of, gave him a preview of why we need to see him in person. And thereafter, when he came back in about 3-4 days, I met him in person, and then we went on with a clinical exam and then a biopsy, which unfortunately turned out to be oral cancer. So the point that I'm trying to make is a simple loose tooth, which is, it does not have any other reason for it to be loose, can also be a symptom, which most people can easily overlook.
Right. So having an ulcer or having a loose tooth, like if any person who's watching the video and is concerned, maybe for their family members, so this also could, God forbid, lead to something like this.
But just to make a point that not all loose tooth can also lead to oral cancer. That's something that should not be misunderstood. So the specific case where a loose tooth was not associated with any gum disease, right? It's a standalone problem which does not have any precursor. That's when it's a cause of concern.
Right. Dr. Zainab, could you tell us that the symptoms that you have come across that people commonly ignore, like in this case, there was just like a loose tooth or something that you think in the United Kingdom you must have come across patients like that?
Okay, I will actually talk from both the perspectives because I've come across more cases of oral cancer in India than here, but I know what the risk factors for oral cancer are in the UK. I will preface by saying that oral cancer, it doesn't just show up overnight, right? It's usually a result of months, years, sometimes even decades of repeated irritation or damage to the lining of the mouth, right? So you can think of habits like chewing tobacco, betel quid, areca nut, right? Smoking, drinking, or sometimes there can be factors like Dr. Rajni said, where someone can be a complete not into any of these habits and still get it. And sometimes something as small as a sharp tooth, right, which is rubbing against the lining of the cheek, can lead to this. So over time, what happens is that the oral mucosa, which is the skin inside your mouth, it starts to change, right? And that's the body's way of adapting. But sometimes that adaptation goes wrong. So this could appear as a white patch, a red patch, or as a small ulcer that just won't heal. And this is the body really giving warning signs, giving those red flags. But again, I would say that there is nuance in it. So we have terms for what these early red-white patches are, but not all of them lead to cancer. However, again, if there is a patch in the mouth, if there is a swelling, that is not healing. And the golden rule of thumb is that you observe it for 2-3 weeks, and if it's not going away, there isn't any change, then it's better to get it looked at. Now, here in the UK, the biggest reason for oral cancer is actually HPV, which is human papillomavirus, and what that causes is oropharyngeal cancer. So these are basically lesions which occur deeper in the mouth, in the throat, and it's linked to a rising number of cases here, and they're affecting young people, they're affecting people who don't give a history of smoking or tobacco use or drinking, and these are harder to spot than say lesions which are associated with those kind of risk factors. And the problem is a lot of times these lesions don't hurt, right? So you could have a white patch or a red patch, but pain wouldn't be a symptom, and that's why it's also easier to ignore at times. But again, if there is something which is appearing out of normal in the mouth, and what I have come across mostly is red and white patches
So
which have
it's
not healed.
painless. If it is
Painless.
painless,
A lot of
then it's
times it's
advisable.
painless. Yeah,
Then it's advisable that people should, in any case, go and visit for a dental checkup because it could be painless as well if the lesion is there.
absolutely.
Understand. Dr. Rajni, you spoke about SmartCheck, which is a software built by ToothLens. Could you just throw some light? How accurate and efficient is it to catch the early signs when patients feel nothing, as Dr. Zainab said? Usually it's very painless. There can be like a swelling or a lesion. So, how accurate is SmartCheck on that aspect?
So SmartCheck is a wonderful application for a self-check by any person. It's very easy to use, and it just takes a few clinical pictures of the mouth with some set of instructions. So a self-check, especially for patients or people who already have these habits which contribute to a higher incidence of oral cancer. At least make it a monthly exercise to use a AI scan like SmartCheck app, which gives us an idea as to what are the changes that from a dentist's eye. Of course, AI has, especially deep learning in AI, has gained tremendously to identify specific cases of abnormalities where you can actually distinguish between what is normal and what is not normal. It also distinguishes to the level of what can be indicative of a benign versus a cancerous lesion. So all these AI results that we get with the SmartCheck, along with a dentist's eye, would give 100% accuracy in indicating what is not right, and thereby increasing the awareness for the person to actually come in for a clinical consult or refer him to an oral surgeon or an oral cancer specialist when we see the signs. So AI helps in a great extent because it looks for abnormalities. It's learned from so many millions of data, which even a trained eye can miss at times. So it's a wonderful tool to use, especially in remote areas, hard to reach areas where people are not able to access a dentist very easily. And even for people like one of my previous experiences where the person was traveling. So these kind of not inaccessible patients can really use this AI tool, which will help us educate them more and thereby prevent what can be potentially, yes.
So if we also target at the remote locations where dentists are not available and stuff, how user friendly is the SmartCheck in terms of let's start with the people?
Well, in India, everybody has a smartphone, be it in the rural area. In fact, they have wonderful knowledge of how to use a smartphone more than anything else. So this AI app is very, very simple. It's like taking a selfie. It's just like how you would take a selfie on a vacation spot. It's like taking a selfie of your mouth. It's that simple.
Does it give the proper labeling that there is an issue, let's say root canal, or there's like an oral cancer symptom, or does it like give a labeling, or it just like says that there is potentially a issue in your like mouth?
It does label when it is 100% matched. It does give an accurate labeling, but other areas it does give an indication of that there is a potential problem, so that we can correlate the finding and come up with a proper diagnosis.
Got it. Just one last question around this would be if you could share any example that where ToothLens has probably helped flag something really serious. It would not be maybe oral cancer related, but maybe something like really serious which the tool has been able to flag.
Well, multiple times it has flagged up. The most common tooth problem is tooth decay, the dental problem in India. So there are so many instances where people are not aware because of hard to reach areas. People really don't check their teeth. Maximum they look at their teeth is the 2-minute brushing or the 1-minute brushing they do in the mouth. So when this program is meticulously introduced in their oral hygiene and maintenance schedule, it picks up areas of concern even before the actual problem starts. as simple as tooth decay, which is like a 100% accuracy in areas where people would not know themselves unless it leads to a pain. Only the tooth pain drives them to the dentist. So it can identify those areas very easily, and it also identifies gum issues, redness, soreness of the gum, which again may be asymptomatic. So all these are identified very easily, and it's wonderful tool for a preventive approach to dental care.
Got it. Dr. Zainab, you've also been building low-cost, accessible tools for the marginalized countries as well, like Pakistan and Bangladesh. We spoke about. What is your take on the screening kits and a mobile app for early detection? I'm asking this is because you're targeting at that location, and AI is still, people are very apprehensive about. Oh, I don't know if it will be able to detect. So, what are the kind of feedback you've gotten, especially in that low resource or remote areas?
Yeah, I will secondly start by saying that we have known for decades that early detection saves lives. We've had a landmark study back in the 90s, which was a famous Kerala trial, which showed that visual screening by trained health workers reduced oral cancer mortality by up to 35% in high-risk groups. The challenge has always been scale, and like Dr. Rajini said, it's reaching those remote underserved populations, right, where most of these cases are found. Now with smartphone again in every pocket, mobile health is changing that game. We are looking to train community health workers who can go out and capture these images of suspicious lesions and then send them to specialists remotely. We're looking in to see how AI can be used for triaging these cases, and there's been quite a lot of successful examples of that. There's a cancer research group in Malaysia who built an app called Mimosa. Again, there's a group in South India, Professor Praveen Barur, who have also built an app, and that's what we're also trying to do. I think one of the things that we're working, especially focusing on, is building deep learning models which can work on low power devices where we don't need high internet connectivity entirely. And we are starting to, so we've already done one bit, which is to see can we actually task shift to community health workers, and that's research that we did in India and Bangladesh in 2022. For that, we actually built an oral cancer screening toolkit. Now, as you would know that, to be able to do oral cancer screening, I mean, usually it's the dentist who do it, and they go through 5 years of rigorous training to get trained to have the competency and the knowledge to do it. But we don't have enough dentists. I mean, there are areas in India where you'd get one dentist for, say, 50,000 people. So access to specialists is still a problem. So we've looked at actually task shifting to community health workers who are more widely integrated and saying, can we teach them the clinical skills which normally someone would have to go to a dental school for? Can we build knowledge and competency and confidence in them to do this? And we've done it we've got great results. Now we're looking to actually integrate all of this learning into an app and build AI. And I think one of the things with AI is, like, we've seen enough evidence that we've seen the potential that this works in oral cancer screening, but to build something that can be implemented and integrated, we still need large amounts of data. So that is what we're doing. We're looking to collect 80,000 unique images in these South Asian communities and train a model, and hopefully in the next few years we would have it ready and test it out and get those initial results.
So how does this oral cancer trends differ globally? Is there does it differ that way globally? Like many factors, like I was just researching about it, some factors like HPV and all of that. So how can what India could do more to be aware of such things?
So definitely we see it. First of all, 60 to 70% of the cases of oral cancers occur in the global south, especially in South Asian countries, and that's down to the risk factors, like we said, chewing tobacco, gutka, kenny, pan, betel nut. And part of it is because it's deeply embedded in our cultural norms. So we say that smoking is bad and smoking's become a taboo, but chewing tobacco is not as much. And there are lots of varieties of tobacco. It's very unregulated. So there is quite a high concentration of toxins within these products. That is necessarily not the case with Western countries, where, first of all, the prevalence of smokeless tobacco is not as much. I think smoking is still higher. But because of that, the factors also vary. For example, in the UK, HPV is the biggest factor, especially in men aged 40 to 60, and which is why here in the UK they've now rolled out HPV vaccination for boys as well as girls. So we're looking to do prevention, but we're also looking to do targeted prevention. Now, no country as such has a national oral cancer screening program. I mean, here in the UK, we have cancer screening programs for cervical cancer, for bowel cancer, lung cancer. And the reason is it just doesn't meet that criteria. It has to meet certain criteria. I won't go into detail, but this is the Wilson and Jugner criteria. So it also has to, for anything that we do at a policy level, it has to justify the resources. And what we can do is actually put up policies in place, put up prevention strategies in place which target these high-risk people, because that's the evidence that we have, not just from India, but also other countries, where whatever programs we do for high-risk people, they seem to have a much better, outcome. So it's, again, knowing in what particular population, what are the risk factors, and then building a program around that. I don't know, Dr. Rajni, if you'd like to add something.
Oh, I think that what you said is perfectly fine. Yeah.
So basically, because of gutka and tobacco, that's the reason why cases from India and other southeast region, the cases are more. And in the UK, I can assume that it's related to HPV related. Is that so?
It's related to, yeah, in most of the population. However, I would like to point out that within ethnic minorities here in the UK, smokeless tobacco is still a risk factor, and we are now starting to see that oral cancer is disproportionately affecting the ethnic minorities here. So in a way, the risk is traveling with the people. So, people who even have migrated 50 years ago, they're still using tobacco. Those social norms, cultural norms are still embedded. So even within a country, you cannot say that there's just one risk factor. But yes, overall, we see more cases related to HPV.
Got it. I would like to understand how often are these cases where people have not even touched a cigarette in their entire life, or like maybe not even done vaping or any other stuff, and they still have gotten the oral cancer. So what I'm trying to understand is this also like genetic? Some people can have it even though they've not touched the cigarette in their lives. Any cases, any stats on that, Dr. Rajini, present?
I could go. Yes, you're absolutely right, Sukanya. We do, genetics does play a big role. And we've got HPV, and similar to an example that Dr. Rajini gave earlier of her patient who wasn't engaging in any of these risk habits. So we still see those, but I think the percentage of that is quite low. Here, I would say, in the UK at least, I could talk about it, is less than 4% people who would get oral cancer, which is not related to those common risk factors. And now that we have got a targeted vaccination program, we're starting to see the prevalence of oral cancer, the incidence coming down. I don't know, Dr. Rajni, if you'd like to add from India's perspective.
Yeah, I agree with you. Out here in India also, I think 95% of the cases are attributed to some sort of tobacco use. So the percentage would be very limited, very minimal when it comes to a non-user.
Got it.
Of course, there are other lifestyle habits, alcohol, maybe the food habits. All those also probably play a part in presenting for patients, for people who don't have any risk, any tobacco consumption or any other habits.
Absolutely. And these can be synergistic. So when we look at the risk of getting oral cancer due to smoking and a risk of getting oral cancer due to alcohol, the combined risk when someone's engaging in both of those behaviors is much higher than individual risks. So there are a lot of factors that are interplay into this.
Got it. Dr. Rajni, I'll ask this question of Zainab as well. So, what are these 2, 3 early warning signs that people should not miss at all, or they should not ignore? I've understood, although you said like ulcer or maybe the loose tooth, but because it's also very surprising that it can be painless, so which means people would not even understand that they are going through such a big issue. So, any early warnings which you would like people to remember via this podcast that okay, if something like this happens, it's high time they need to visit a dentist.
It's very important to follow the 2-week rule. Anything that is not healed in 2 weeks, whether it's painful, painless, doesn't matter. When you have a non-healing sore, due to whatever be the reason, that has to be looked into, right? Any change in the color of the gums, redness, increased redness, or increased swelling that they notice. On the roof of the mouth, we call it the palate, basically where your tongue touches when you speak. Sometimes you can feel a small lump there, which may not be painful at all. It may not cause any symptoms at all. But again, that's the point that needs to be considered. Anything that is not healing anywhere in the mouth, sometimes at the base of the tongue. So these are areas, some swellings in the neck or under the jawline, which are visible, but again painless. Anything that does not heal in a couple of weeks. So the 15-day rule is kind of very important. When it doesn't heal, you have to get it checked out.
Got it. And what's the piece of advice Dr. Zainab would like to give someone who's listening to the podcast that one thing that they can do today to protect themselves from oral cancer, whether they smoke or they don't smoke?
This is a hard question for me because I usually don't like giving blanket advice or generic advice because I know it may not be applicable to everyone, but I think from what we have discussed, we know that early detection is the key to better disease outcomes. So I would suggest that, if people, even when they're visiting their dentist, if they could just ask them, right, can you do a quick screen? That I think is something, is just also having that awareness. Because if you were to notice, just to give an analogy, if you notice a bruise on your hand, right, and if it doesn't go away, you would get concerned after a week or 2, and you would get it checked. So just having that awareness of what normal looks like in the mouth, so that people could also, and it's difficult, I understand, but yeah, having that awareness, and that every time they're visiting the dentist, maybe making sure that they are being specifically screened for cancer.
Got it. Thank you, Dr. Rajini and Dr. Zainab, for this wonderful conversation, powerful conversation. This has been a very informative session. I've tried to make it in such a way that anybody who doesn't even belong to the dentistry field can also understand in a layman's term what are the symptoms and prevention that they can, so that they can take better care of themselves, their friends, and their families. We'll be back soon with the episode 2 on another important topic, and this will be live on April 30th. Thank you very much.